If you make it more affordable that the people don't have insurance can buy into that plan, and don't put such a heavy burden on you know, the rest of these issues that allow it to be defeated.
I've always thought that you know, when an employer and an employee are negotiating in contracts and everything, the two people that shouldn't be in the room are the Wall Street bondholders or stockholders that are involved in the retirement, and also the healthcare insurance industry, which is neither of which really has an interest in the employee or the employer. However, that seems to be our system, where those are benefits that are existing. I always thought unions were very important for, you know, wage, you know, contract termination, wages, working conditions, and procedures for grievances and whatnot. But when I see this healthcare develop over the years, we're all basically, it seems we're all basically paying for the uninsured anyway. And this is a means to try to expand the coverage to lower everyone's healthcare costs by putting some competition. I know they want a government plan in there as an option. To me, a government option plan is to have the same plan as a congressman. Because I looked on a website once, I saw that for a single congressman, I don't think it was a family plan, was like $80 bi-weekly that they paid, and 75% of that was paid by the taxpayers. So that's a government. If that was a government option, I'd surely like to have the ability to do that, and that evidently applied to all federal employees. In fact, Senator Grassley, I think it was, mentioned that when someone asked him if they wanted a government option, he said, well, become a government worker, you'll get the government option. And I thought that was really condescending on his part.
Well, yeah, and I agree. You know, it even goes further into the issue when you talk about who's at the table negotiating, because again, that's why you have big lobbying companies,
yeah,
powerful lobbyists.
If I had a business and I had employees, let's say the 100 that I mentioned before, I don't want to worry about the health insurance industry coming in and trying to muscle in either way, or I have to worry about retirement here. I would like to give my employees enough money so that they can get their own retirement or their own health care and have it all available. So that'd be the perfect utopia.
Well, and you know what, and I'm glad you said that. Let me talk to you about two union employers in this area that do business against Walmart. Our PNC stores, okay, up out of Syracuse, Penn Traffic, and our top stores in Buffalo. These are two employers that pay. They, you know, as healthcare escalates every year, you know, it's getting out of hand. And then when you have pension reform problems like most unions have and most Taft-Hartley plans have, it becomes more burdensome, because that's more money that has to go into there and less money into your healthcare. You know, you have a pie, no matter who you are, no matter what your negotiations are, but a pie of resources. But when you talk about our union employers, you know, they're paying the dollars. And when I talk to both employers, you know what they say to me? They feel obligated that's what makes their employees a better, you know, a better employee, because they feel comfortable enough that they know they're coming to work for an employer, especially the full-timers with their career jobs, and they're coming to work knowing that this employer is willing to say, listen, I'm worried about your daughter Sue, I'm worried about your son Ed, you know, I'm worried about your family, so therefore we're going to provide you comforts at no copay, because as a union contract we negotiate it. Now, I'm not saying, you know, all insurances or all contracts should be no copay on the employee, but my point is this: you have good employers out there. Now, for that, what do? They get a tax credit. Right now, they get a tax credit for their contribution that they pay on health care, and they also get the feeling and knowing that they're covering their employees, and they're doing what is number one, the morally right thing to do, and B, number two, a good employer. But you take the employers out there, as I said, the Walmarts, or for that matter, any other major corporation. Again, I'm going to eliminate that small business that maybe employs 10, 15, 25 people, 50 people, because, you know, it's hard in this economy in this day. So I think maybe there has to be a separate situation to try to cover those people. But again, I'm zeroing in on what I believe to be the people, the corporations, the companies, the employers that can afford it. $12 billion profit. That's a lot of money. I mean, and I think the estimate would be a little bit less than $600 million, I've read one time, to cover all your employees. Sounds like a lot of money, but on $12 billion profit, it's really not a lot of money.
Well, I heard that the insurance companies made 150% profit from last year, raising profit from last year. So it must be a very profitable industry to the healthcare.
You know, it's
insurance
funny, I've never seen an insurance company file bankruptcy.
I do recall.
AIG.
I do recall.
They robbed them.
Well, that's
well,
because
AIG
they stole
They
it.
robbed them.
AIG got their money back because everyone was insured with them, evidently.
You're right, you're right.
Rick, let me just say something.
Sure.
You talked about the public plan, and Michael Arcuri had a session over in Mohawk Valley Community College the other day, and from the crowd he got a lot of flack about the public plan. Michael Arcuri said, I agree with you, and I will tell you that if there is a public option in this new plan, that Michael Arcuri will take that. And he said a lot of other Congress people will do the same thing. So I think there's some sincerity down in Washington, much to a lot of people's disbelief, but there's some sincerity down there that want to do the right thing.
Well, you know, Bill, and again, these numbers, I'm assuming they're right, but in this world, when we're, what, 39th in healthcare, we're supposed to be the #1 nation in the world, and we're 39th in healthcare coverage. There's a problem, so the problem has to be addressed. Now, to what extent, I don't know, but to say status quo or leave things as they are, because the insurance companies, everybody else thinks there's no problem. The drug companies, they're another ones, forget that, you know. But at 39th, you got a problem.
I also know that, like, a couple years ago, Toyota had a plant in Michigan. I think they moved it to Canada or somewhere up there. They moved it to Canada because of Canada's healthcare system. At least they didn't have to cover the employees. So I mean, there's give and take here, and I think what eventually will occur is some competition in the area, and that's the best way we can do it.
I think right now you're going to see something happen for the simple reason it's been 40 years that they talked about making a change in healthcare for the general public, and it hasn't happened. I think enough people should be embarrassed by that are in a position to change it, that it's going to happen to some extent. And at that point, we've got a base, and they can improve it. But I think, in my opinion, it's been too long that the poor people are suffering and don't have health insurance. What do you do without health insurance?
Well, there's been, you know, you talk about a government option. Medicare is a government option that, you know, it's a program, it's a government program. Medicaid is a government program.
So Social Security.
Social Security, but I don't see anyone, you know, blasting that or wanting to do away with it. Sure, things have to be corrected from time to time, but I don't. So this concept of giving people an option, if they're giving me the option to have the same kind of coverage or purchase the same kind of coverage as a government employee, I'd love it myself. Yeah. But we'll see where that develops. And I want to thank you very much for coming in. You've been talking to Frank DeRiso. He was the president of the United Food Commercial Union.
Well, Rich, I really enjoyed it. And if you ever want to do a show on pension reform, I'd like to come in here, because that's another big problem. You know, we talk about, I know at my international, I'm an executive board, I'm an officer of our international, and you know, everybody's talking about healthcare reform, and it's rightly so, but I made the statement that, you know, pension reform right now, and with some of the legislation and things that occurred in the market 2 years ago and last year,
I'd like to see
I got to tell you something, pensions are very seriously in jeopardy right now, and that's something that if it collapses, now we've got another problem with the economy, because all these older people are going to be retiring and have no income.
That's me. So I'm concerned about it.
Well, we'd certainly like to have you come back and talk about that, and also some of the topics we've just touched upon today. We can have a little more discussion on. But I want to thank you very much for coming in today.
Thank you.
Thank you very much.
Thank you.